Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
Good afternoon and welcome. I'm Wayne Callan, and you're listening to another Attitude ADHD Experts webinar. Today's webinar is aimed at the many parents and their children struggling with dyslexia and ADHD. We know that kids diagnosed with ADHD have a good chance, maybe 50 to 60%, of also having a learning disability. The most common of these is dyslexia, a language-based learning disability that affects reading. 8 to 17% of the population is affected by dyslexia, but it is vastly misunderstood. Contrary to popular belief, dyslexia is not reading letters or words backward. It manifests itself in different ways in different children. Children with dyslexia may have difficulty with phonemic awareness, which is the recognition and breaking down of the sounds of letters. A difficulty in segmenting words is also common to the disorder. The thing to know is that ADHD symptoms are exacerbated by dyslexia and vice versa. What's more, research has found differences in dyslexic and non-dyslexic brains. Our expert today, Roberto Olivardia, knows all about dyslexia. He is a clinical instructor of psychology at Harvard Medical School, and his own son has been diagnosed with the learning disability. He knows what parents go through when they receive a diagnosis, and more importantly, he knows about the best interventions for dyslexia. Dr. Olivardia has a private practice in Lexington, Massachusetts. The sponsor of this week's Attitude webinar is the Gow School. The Gow School is a college prep co-ed boarding and day school for students, grades 6 through 12, with dyslexia and similar language-based learning disabilities, also offering a 5-week summer program for campers ages 8 through 16. Visit them at www.gow.org. So I'll turn it over to Dr. Olivardia. Thanks for being here.
Thank you for having me, and I'm really happy to be speaking about this subject. As Wayne had mentioned, I have ADHD, and I have a son with ADHD and dyslexia, and definitely had my share of reading issues and problems when I was young as well. And this is something that co-occurs quite often and interestingly is very misunderstood. So we certainly know that ADHD can be misunderstood, dyslexia very much so. So I'm first going to talk about what exactly dyslexia is, because it is often perceived as people reading words backwards, which is not the case. This is the official definition from the International Dyslexia Association. Quote, dyslexia is a specific learning disability that is neurobiological in origin. It is characterized by difficulties with accurate and or fluent word recognition and by poor spelling and decoding abilities. These difficulties typically result from a deficit in the phonological component of language that is often unexpected in relation to other cognitive abilities and the provision of effective classroom instruction. Secondary consequences may include problems in reading comprehension and reduced reading experience that can impede growth of vocabulary and background knowledge. And I'll break that down a little bit more. It does affect anywhere from 8 to 17% of the population, so it's quite common. And I would say of that population, it is vastly underdiagnosed, and it is definitely neurologically based. And if we have time, I can talk a little bit more about what we know about the brain of individuals with dyslexia. So one of the features, if we were to really break it down, it really starts with, in order to read words, we have to know letters, and we have to know the sounds that go with those letters. And this is something that, on one hand, is quite miraculous that our brain has just evolved to be able to do this, because way back in the day of cavemen and cavewomen, they didn't have words. Everything was pictorial and very visual. But yet our brains have evolved for most people where we see a letter B, that we start to understand that shape and that letter is the B sound. And we develop what's called an automaticity of just having those sounds be automatic to those letters. And so when we talk about a phoneme, we're talking about the smallest units of sound, the B, B, the D, D. And these are sounds that we have to understand in order to put them all together as words. Dyslexics have a very, very hard time with phonemic awareness, and this is something that starts very, very young. So one of the signs that parents might see is their children not being able to match those sounds with the letters, even when they were just told maybe a minute ago, and where it's much more delayed. These are things to be aware of. Syllable segmentation, that dyslexics often don't have this sort of natural automatic way of dividing words in the ways that would help them understand what the word is. So if you take a word like teacher, for example, that we would segment that to be teacher. If someone with dyslexia might look at that and somehow they might put the syllable segment at teak her, and now it's teaker, which is it's not even a word. So for whatever reason, we know that the brain can process this. Now, when we think of prefixes and suffixes, that if you start to understand that P-R-E, is a certain prefix, then you can kind of read that as one block of words. Now, for someone with dyslexia, they might, let's say if it's a word like predate, they might read it as pred-ate, as opposed to understanding and getting automatically that pre is the prefix. Rhyming problems. People with dyslexia don't have, again, that automaticity of, if you know bat, then cat is fairly easy, because as long as you know that the letter C is a k sound, we have the at down. So when you understand at as a word, then bat, cat, fat, hat, mat, pat, all that becomes very easy as long as you can substitute that letter. For someone with dyslexia, it's as if bat and fat and hat are completely separate words. It's almost like there's no unifying principle that comes naturally to people with dyslexia. So imagine how difficult that is when you think about how we learn to read is really building upon these foundations of how we even understand sounds and letters, and the automaticity that we grow to know these sounds and letters. Visually tracking words. People with dyslexia have hard time in terms of visually tracking, going from word to word to word. They might find themselves skipping around, and not necessarily due to attention issues, which we'll talk about later in terms of the influence of ADHD. Poor automaticity of sight words. There are lots of words in the English language that really don't follow the sound principles. Like the word of is not spelled O-V, it's O-F, which if we really were to say it phonetically would be off, but that's not what it is. So we have to memorize that O-F is of, A-N is an, T-H-E is the, and these are very difficult for dyslexics. In fact, one of the first signs that I noticed that my son had dyslexia, other than the fact of being aware that being in a family of people with ADHD and learning issues, I knew what the heritability, the genetic transmission rate was. But when he was 5 and he was reading a book, he had a very, very hard time with the word the. And I said, that's the. And it was a sentence that's read something to the degree of the cat went down the street, and he was trying to pronounce the word the, and I said the, and he said the, and then the cat went down, and there was the word the again, and he looked at it and he was trying to decode it like it was a whole new word. And I said, oh, that's the same word as that. And he didn't remember it. And this is not someone who had a terrible memory. In fact, my son had an amazing, impeccable memory. But when it came to words, there was a very large disparity in terms of his ability to remember that. So that was, I remember, the first moment that I thought, okay, this could be something. People with dyslexia have a very, very hard time spelling. And interestingly, though, it's not that their spelling is chaotic, it's that they spell phonetically. So if you can reading the spelling of someone with dyslexia is actually almost looking at words in the ways that they sound. So the word of would be spelled O-V. The word... let's see, what's another word? The word book, as opposed to B-O-O-K, which would be book, might be B-O-K. So the spelling is really following these phonetic principles, but the English language doesn't follow phonetic principles. The word knife is not spelled N-I-F-E, which is how a dyslexic would spell it. It's K-N-I-F-E because of that silent K rule. There's something called speeded naming deficits, which is if I asked you to name me 10 things that are red, name me 20 animals that you might see at a zoo. People with dyslexia have a very hard time conjuring up things in this very rapid way. In fact, there's a term called double deficit dyslexia, which is what my son was diagnosed with at the age of 6, which is a combination of having deficits in speeded naming as well as phonemic awareness. Now, I'm going to talk about some of the features. Now, these aren't particular symptoms or diagnostic criteria, but features that parents can look out for to question and wonder whether their child might be dyslexic. In preschool, one of the first symptoms is actually kids who are late talkers. And interestingly, I have a daughter who's 9, and she was a very late talker, and we had her in early intervention for speech. And I was convinced she was going to have dyslexia because of the knowledge of this piece of information. And it turns out my son, who was an early talker, was the one with dyslexia. So none of these are kind of surefire diagnostic criteria, but again, you'll often see that a lot of dyslexics were late talkers or had issues with speech, chronic ear infections, issues with left-right confusion, sometimes to the degree that you might even see an ambidexterity. I see that even in myself. I was actually born a lefty, and my kindergarten teacher made me a righty. And to this day, I still have a lot of problems with left and right. I remember actually learning if I'm facing somebody, if we're face-to-face, it's still hard for me to identify what is someone's left and right hand if they're facing me, because I almost want to make their left hand, knowing that it lines up with my right hand, and I have to kind of ground myself. Anything athletically I do is like a left-handed person, although I write very messily with my right hand. Difficulty tying shoes, again, issues with rhyming. In elementary school, you might continue to see very poor handwriting to the point of a diagnosis of dysgraphia, which without a doubt I would have been diagnosed with as a child if more was known then as what we know now. My handwriting was pretty illegible until I was in the 5th or 6th grade. Letter number reversals, and what I mean by that is the letter D written as the letter B, numbers like the 3, instead of being written, towards the left, it's written towards the right. Cursive writing is very difficult. I mean, to the degree that a lot of kids with dyslexia, I often recommend that they don't even have to learn that, to sort of just place them out of that, because that can be very, very difficult. And these days, honestly, as much as it can be a beautifully written aesthetic, it's not as necessary. Very slow, choppy, inaccurate reading, poor spelling. Even when speaking, you might find that people with dyslexia have a difficulty finding the right word. And again, this is not correlated with their overall language ability. And even in my son, he would be someone who would have a very illustrious vocabulary, and then at times for not be able to access the word fork, or something that was very common, like the chair. It'd be, sit on this thingy, or you know what I mean. Dr. Seuss books, which are fantastic books in general, are great books because in Dr. Seuss books, there's a tremendous amount of nonsense words, but they all follow rhyming principles. So for someone with dyslexia, that's very difficult because, again, if you say the zoot is in the hoot, in the moot, and has a lute, then it's very easy for many people, again, if you get that phonetic principle that it's the oot sound, and all we're doing is substituting a letter. For someone with dyslexia, those words are as if you're saying sparkling, Buddhist, sign, globe. They're just completely different words to them. In high school, all the previously mentioned things, plus you'll see that it's very difficult sometimes for dyslexics to also have issues with writing, being that there's a discrepancy between their verbal skills and being able to put their thoughts on paper, something that's been known as the disorder of written expression. Foreign languages can be very, very difficult, again, to the point where I often recommend waiving that as a requirement. Although, interestingly, I've had a number of dyslexic clients who have taken Mandarin or some of the sort of Asian languages where the symbols are not based on these kind of phonetic principles, but more pictorial or visual principles, or American Sign Language, which is more kinesthetic, and do well with that. So it's very interesting to think about Foreign language doesn't have to just be the Romance languages, obviously. They might mispronounce expected words. Instead of saying there are lots of volcanoes in Hawaii, they might say tornadoes. And not because they are really thinking about a tornado, but it's almost these substitutions of words. Instead of saying satisfied, they say satisficated, almost adding syllables, and taking a lot longer than expected to get through work. And in adulthood, and I work with many adults who basically have dyslexia but weren't diagnosed as children, or have children that were diagnosed with dyslexia and realize, oh my gosh, that's me. And in adulthood, you'll often see a lot of self-esteem issues if it's not something that was identified. Adults who have a tremendously slow time reading through things. They might have to reread things several times to understand it. They dread writing even quick emails because a quick email really isn't quick for them. They will often gravitate to careers that don't rely on heavy reading, and often avoid or hate reading fiction. And I put that out there because also for parents who might have their child already diagnosed with dyslexia, who might be getting services through the school, is make sure that scores and assessments are being done not only with reading in general, but making a distinction between fiction and nonfiction reading. Because generally, you'll find a higher capacity for nonfiction reading than fiction. And part of that is because of nonfiction reading, the vocabulary is a lot more limited, so words actually get memorized fairly quickly. So sometimes kids might look like they're reading, but they've just learned to memorize blocks of words. And in fiction reading, there's a much wider vocabulary. There's a lot more reliance on metaphors and similes, and in comprehension, the comprehension demand is much higher in fiction reading than nonfiction reading. And that's also true for people with ADD who often gravitate towards nonfiction reading, because you can open up a book on chapter 5 and start reading and you're fine. You can't open up a book on chapter 5 in a fiction book and be okay. You'll have no idea what's going on. Now, having said that, I have not read a fiction book in 25 years, for that reason. But there are a lot of social emotional issues that are so important that we see with both ADHD and individuals with dyslexia, that other than a lot of the academic difficulties that can come along with ADHD, which is been well told, but when you have dyslexia as well, it just gets completely exacerbated. So it can leave a lot of kids feeling stupid and feeling dumb. They might find themselves being socially isolated. And what I'm also talking about is when this has not been diagnosed or caught, that these are kids that are at high risk for being bullied. They might feel a chronic amount of stress of even going to school, and often have a lot of somatic complaints in the morning, stomach aches, migraine headaches. They feel dizzy. They feel headaches. Children often manifest their anxiety in very physical ways. So even if you ask them, are you stressed or anxious, they may actually say, no, I'm not, but it's only because they're not even aware of it. It just kind of comes out in their body. I've worked with many kids who have issues with school refusal and going to school, and I would say the top 3 reasons for school refusal are someone who's being bullied, a child with a learning disability, or just general anxiety. But learning disability is one of the top 3, and because it makes someone prone to being bullied, and it creates a tremendous amount of anxiety. And unfortunately, certainly in the past, although the statistics are getting better with more awareness and education and intervention, but children with undiagnosed dyslexia are at higher risk of dropping out of high school, particularly if the intervention for their dyslexia is to repeat a grade, which never works. In fact, the statistics are very grim when a child has to repeat a grade because of failure. It's one thing if in kindergarten a child repeats a year for maturity and emotional reasons. I'm talking about the child who in 3rd grade is not making any of the milestones, and they say, well, let's keep them back a year. And that does nothing. That's like me speaking to you in a foreign language that you don't understand, and if you don't do well on your test, to say, well, let's have you repeat the year, and I'll still talk to you in this foreign language that you don't understand, and just have you go through it again. It's not going to do anything. These kids are at high risk for depression and a feeling of learned helplessness, which means that they learn very quickly that no matter what effort they put into something, they're not going to get and achieve the result that they're looking for. So why bother? Now, it's understandable why ADHD and dyslexia can sometimes either get confused for one another, or where one condition can be diagnosed and the other isn't, because they can often, the symptoms can often subsume under each other. Both people with ADHD and dyslexia have information processing speed deficits, particularly inattentive ADD types, where it could feel they need sort of a little bit longer of a time to kind of process material that might be particularly dense to them. Working memory deficits, naming speed, motor skills deficits, issues with time and time perception. And actually, even in neurological research, find that both of them share subtle abnormalities in the cerebellum, which is a part of the brain that's linked to how we perceive time, balance, in terms of balancing our bodies, and precise timing of our motor responses. Now, there are differences as well, and these are just kind of some quick differences so that people can start to make some differential diagnosis. People with ADHD don't have an issue with phonological processing, so they might maybe mispronounce words, but maybe because they're reading through it too quickly or too impulsively, or they're so bored that they're not even really sitting with the word. Whereas if you say, okay, I want you to read this word carefully, they're able to decode it. They're able to process that. ADHD individuals sometimes don't like to read either, and they might hate reading, but not because they can't read, but because their interest isn't there. And in fact, sometimes you'll see kids with ADHD who don't have dyslexia who hate reading the books that are assigned in school, but will go through 20 anime novels, or will read about their favorite athlete or rock star or whatnot without any issue. That's not dyslexia. That's definitely the ADHD. Kids with ADHD tend to have more issues socially than kids with dyslexia, probably because of the impulsivity and hyperactivity. Kids with ADD will fidget more and have problems concentrating on unstimulating tasks, whereas they have often very little issue concentrating when the task is very stimulating to them. For dyslexia, it doesn't make a difference. That's not going to affect their ability to decode words, whether their interest is high or low, or whether it's stimulating or not. Dyslexics are poor spellers, as I mentioned. They spell very phonetically. People with ADHD, their spelling might be poor, but often as a function, again, of their impulsivity. So I see even in my own son, when he'll write something. Now, he has both ADD and dyslexia, and so I'll say, well, that word there, I want you to pause for a moment. How do you spell that word? And he sometimes will spell it correctly. So sometimes it is a function of his impulsivity, and sometimes he's spelling it in it's the dyslexia. And so we've sort of developed a way of talking about this by saying, is this the ADD? Is this the dyslexia? So that we can make that differential diagnosis. Dyslexics often have a lot better audio processing than some people, and this is, again, when I'm talking about any of these things, I'm talking about whole group differences. Individuals, there are lots of individual differences, but as a whole, kids with ADHD often have audio processing deficits. I can certainly relate to that. It was very difficult for me to sit in high school or in 101 classes in college and just be spoken to. I did much better in classes where there was more dialogue and back and forth, whereas lots of people with dyslexia, and thankfully my son has excellent audio processing skills, and there are theories that say that perhaps that's a compensation for their inability to get sort of all that information through the text, that they can become super aware when something is said to them, which is why audiobooks are wonderful for kids with dyslexia and adults. Dyslexics, you'll often again see that reversal of letters and numbers that are quite persistent. Now, one of the things is, we know, for those of you who listen to a lot of wonderful webinars that are here on Attitude and around, that there's this dialogue in the ADHD community. Is this an illness? Is it a gift? Is it a curse? I look at it at, ADHD, just is, that if it's not treated, if it's not intervened, if you don't have strategies, it will cause great impairment in your life, and it could very well take you to a dark place. If you acknowledge it, if you accept it, if you're educated on it, if you're treated for it, it could be the thing that actually drives you to success. Dyslexia is very similar. Dyslexia is not by nature hazardous to your health. That it's not dyslexia in and of itself is not going to hold somebody back from achieving their goals or being successful. But the lack of identifying that dyslexia and the lack of intervening on that dyslexia absolutely is hazardous, not only psychologically, as I talked about, but academically and to a person's career potential. In fact, studies show that kids who are identified early endorse a very high sense of control and confidence and score very similarly on self-esteem than their non-dyslexic counterparts. So we need early identification. Don't listen to people who say, well, wait till 4th grade, 5th grade. You can diagnose dyslexia. Now, my son got tested. He was right before 1st grade, and my colleague who did the testing said that 6 was the age where a lot of the instruments were normed for. That may change, so consult with a neuropsychologist, but I know by at least 6, you can have a definitive diagnosis. Unfortunately, many children are not given the proper label of dyslexia. They might be given label of reading problems, a non-specific learning disability, and as a result, they're not availed to the empirically based interventions that are out there that we know work for people with dyslexia. And unfortunately, there is a political sort of spin to this in terms of school systems have to then employ teachers that are certified, that have experience with this. They have to often these kids have to be in different classrooms than the kids who don't struggle with dyslexia. And also, what we also find, other than the lack of early identification, is once you teach a child about self-advocacy and to accept dyslexia, to not see it as a pathology, again, you don't see the disparity in self-esteem. So I came up with this term, so we all know that there's IEPs, which are individualized education plans that you might have your child in if they need special education services. So I use the term an ignorance protection plan, or an IPP. And when my son was diagnosed in 1st grade, we sat down and I got all these children's books on dyslexia, and I said, this is what is making it hard for you to read. There's this thing called dyslexia, and at that point, ADD was very largely talked about in the household, and I said, Daddy had problems reading as a kid, and his mother also had issues with reading, and it's just in the family. And I said to him, and you can obviously couch the vocabulary as to what you think is going to work best for your child, but I said, there's lots of people that don't know anything about this, and some people are going to think you're stupid because you don't know how to read, and they're wrong, because this is not about intelligence. In fact, we know from your testing that you're actually quite bright, but I didn't need the testing to show me that. I said, so you're going to come across those situations, and we role play different situations, and I said, some people are going to think you're not intelligent, some people are going to be mean about it, and some people aren't going to be mean, but they're just going to be surprised by it, and they might say things like, oh, wow, I thought you were smart, and not meaning to be malicious in any way. And one of my proudest moments as a father is I remember literally 2 weeks after that conversation, it was 1st grade, my son came out and he said, Dad, he goes, I was in a music class and we were singing, it was some song, and they were given the lyrics to the song. And at that point, he was a non-reader. His dyslexia was quite severe. He's in 6th grade now and he's made tremendous progress. But at that time, he couldn't read anything. And he turned to the girl next to him and he said, oh, do you mind reading these words to me as we're singing? And she said, you can't read those words? And he said, and I remember what you said, that I don't think she was being mean. She was just really surprised. And he casually said to her, oh, no, I have this thing called dyslexia. It makes it very difficult to read. In fact, Walt Disney has it, and some of the sharks on Shark Tank. And he started naming all of these people. And she went, oh, okay. And she just read him the words. Like, it was no big deal. And I thought, oh my gosh, that could have been a moment that, had he not had that context, could have shamed him and made him feel really stupid. So we need to arm our kids with the gift of the label, because no parent wants their child to feel different, but that's only because we associate different with a bad thing, with being defective. Your child is different, and they know it. In fact, studies show that when they get the word, when they get the label, they feel positive. They're like, oh, okay, this makes sense. It's not that I'm stupid, because trust me, they know that something is different when their friends are reading Harry Potter in the 2nd grade and they couldn't even imagine reading Harry Potter. They are not alone. A label helps and explains and validates and tells them that there's a wealth of scientific information. I tell my son or people that I talk to, like, I feel blessed that, we have this term ADHD because there is a journal called the Journal of Attention Disorders. There's a magazine, Attitude Magazine, that I feel like when I get an issue of Attitude, and I'm not just saying this because I'm doing an Attitude webinar, I really feel this way. I with joy read the magazine from cover to cover, because I'm like, wow, this is like a magazine about me, about how I think, about how to be in the world and how to be more successful in the world. It feels like a guidebook, and I feel very blessed that we can identify ADHD and dyslexia, and that there is a wealth of research and scientific information. And so I feel like it's a tribe that we're all a part of. So let's define the term before somebody else does, because if we call it something else, we're unintentionally inducing shame. And I've heard this, and I feel for parents, because I know that parents are trying to protect their kids, but I've heard from many parents over the years that have said when their children discover in 6th, 7th grade that they have dyslexia, and they said, why didn't you tell me that I had dyslexia? Why did you call it a reading problem? I just thought I was stupid. And they said, is it that bad that you couldn't use the word? And so it almost made it feel like this dark secret. Assessment-wise, every student with ADHD or dyslexia should be assessed and tested for the other, because 50 to 60% of people with ADHD have a learning disability. And of the learning disabilities, 80% of the time, it's dyslexia. So it's very, very important to always assess for the other. Now, how do we accommodate this? How do we really work with this? Because dyslexia is not just reading more as an intervention, although the more reading, the better. It certainly helps. But dyslexic students need specialized individual instruction. There are programs such as the Wilson program, the Orton-Gillingham program, Linda Mood Bell. These are all empirically derived interventions. And studies actually show there isn't one that reigns supreme. In fact, there are studies that show that depending on the manifestation of the dyslexia, certain programs might appeal better to certain children. And a lot of schools might actually borrow from different programs to really cater to how the dyslexia manifests for the child. Extra time on tests are dramatically helpful for people with dyslexia. Interestingly, studies show is not particularly helpful with just ADHD. If someone has just ADHD without dyslexia, that sometimes extra time actually can produce worse performance. And part of that may be that because people with ADD sometimes function better with a sense of urgency, that if they're told they have 2 hours to do something, their brain might not get activated until the time, towards the end, which isn't going to be helpful. So sometimes having some urgency can actually help one focus. But when there's a learning issue involved, the extra time on tests dramatically helpful. Taping lectures. And these are things that you can put into your child's IEP that as a college student you can do. For an adult who might be at work meetings and have a hard time processing things, all of these things you can do in various settings. As I mentioned, waiving foreign language requirements. Sometimes you have to pick your battles, and there are battles that really, at the end of the day, yes, it's wonderful to know a foreign language if you can, but particularly for people with dyslexia, if it's hard enough to grasp the principles of the English language or their native language, it's going to be very difficult to learn a foreign language. Having note takers, and these are all accommodations, again, that can be even in colleges, people who can take notes for you and share the notes, so that way you can just process from an audio perspective, as opposed to going back and forth and shifting gears, which could be hard for people with ADD and dyslexia. Audio text, wonderful organization, Learning Ally. Bookshare is another one where if you have a diagnosed, documented dyslexia, you submit that paperwork to Learning Ally, and you then basically become available to all of these audiobooks, including college textbooks and high school textbooks that you can hear in audio. And with audio, different in the dyslexia community, different people have different opinions about this. Some will say, you know what, if it's too much of a battle to learn to read printed words, let's just do all audio. I personally take the approach that it's important to focus on learning the printed words. However, use the audio text as a way of not getting you delayed in vocabulary. If the class is reading a certain book and you want to be able to discuss that book and you want to be able to talk about that book, have the audio version of it. Don't let the dyslexia get in the way of being able to participate in that. Speech recognition software like Dragon Speak and Google Voice are fantastic for individuals who might have a hard time kind of typing and putting their words, that they might have an easier time speaking, and at least speaking a rough draft and then going back and editing it. Not having these children required to read out loud in class. One of the most shaming things for a dyslexic kid is being asked to read out loud, when then it becomes evident to everybody that they have problems with reading, and the class laughs at them. They're seen as stupid. That is, I can't tell you how many times I've heard from adults with dyslexia that they can remember the very first time they were asked to read out loud in class and the panic that set in when they had to do that. Not having spelling graded against a student. So if the assignment is write an essay about World War II, and they have to write an essay and they have many spelling errors, that shouldn't matter, because in that point we are grading the content of the basis of knowledge that they have about World War II. If it is a spelling test, then of course you can grade against spelling if that's the purpose of it. But too many times teachers will take off all these points, and what does that do to a child that has problems spelling when the content is there, but they have now 40 points off because of bad spelling? They say, well, what's the point of even putting my ideas down if that's what people are going to pay attention to? Have a child do a rough draft, work it in the IEP, or for kids in college, go try to do a rough draft beforehand, see if you can work with your professor in looking it over before you have to do a final draft. Any multi-sensory approaches to reading, especially for children, work very well when reading is acted out. Using gestures, different tones of voices can really help imprint a lot of that knowledge and words. Keyboarding early for kids who might have a hard time writing. And just as in the ADHD community, we have lots of wonderful role models of success. These are similar role models of individuals with dyslexia. David Neeleman, who also has ADHD, the former CEO of JetBlue Airways. Dyslexic, Richard Branson of Virgin Airways, dyslexic, and there are wonderful YouTube videos actually of him talking very candidly about his dyslexia. Steven Spielberg, who in my eyes is the greatest filmmaker, dyslexic. And women such as Whoopi Goldberg, actress Jennifer Aniston, and the woman on the left is Agatha Christie, who actually, and I put her there because my all-time favorite fiction book, and this is one of my favorite fiction books, one, because it's just a great book, but two, it is the first book assigned to me in school that I actually read cover to cover. And it is the book called And Then There Were None, or 10 Little Indians. It's under both titles. And it turns out Agatha Christie was dyslexic, and there are lots of accounts of her horrific spelling and where she really thought she was dumb, and here she's the most famed mystery writer on the planet. And this is my son's favorite TV show, Shark Tank, and 3 of the sharks on Shark Tank are dyslexic: Damon Johns, Barbara Corcoran, and Kevin O'Leary. And I really recommend you go on YouTube. There are great interviews, particularly with Damon Johns and his mother, talking about his dyslexia as a child. And these are some organizations, of course, Attitude, Understood.org, which is a great organization, the International Dyslexia Association. Big shout out to Decoding Dyslexia, which is a more of a grassroots organization that really fosters support and advocacy. Every state has a chapter. Massachusetts, we have a fantastic chapter led by a woman named Nancy Duggan, who is a tireless advocate for dyslexia, and my son and I have had the pleasure of participating in many advocacy events, including testifying at the Massachusetts State House in support of legislation for early identification of dyslexia, as well as having the term dyslexia on a child's IEP, because in Massachusetts, we don't have that as a formal term. It's still known as a specific learning disability and learning ally. So I will stop there and be open for any questions.
That was great. Terrific presentation. Really terrific. Linda asks, I would like to refer a family for testing. What specific tests are used for a diagnosis of dyslexia?
That's a good question. So typically there's a test called the GORT, or the Gray Oral Reading Test, that is a fairly reliable one. There's the TOEP, which is another one. And it all depends too, as I mentioned, whether it's a decoding issue or comprehension. Fluency is another thing that can affect people with dyslexia. What I didn't mention earlier is that even when, let's say, the decoding is down pat, and that's not an issue, it's now, okay, I can decode a word, but my ability to be fluent through a sentence, through a paragraph, through a page could be greatly impaired if getting through a word costs a lot of energy. So being very aware that just because your child might decode words doesn't mean that they're not dyslexic, that there are different neuropsychological tests. And I would, if that's something you're testing for, ask the neuropsychologist. You have a lot of experience testing and assessing for learning disabilities, for dyslexia. Can you tell me what measures you use and what those measures actually test? And there are lots of them. I know the GORT is one that is sort of one of those kind of standard ones, but there are lots of other ones certainly out there.
How do you spell GORT, G-O-R-T? How?
It stands for the Gray Oral Reading Test.
Okay.
And then another one is the CTOP, and I don't know what it stands for, but it's CTOPP is one that, but again, I'm not a neuropsychologist, but I would defer to a neuropsychologist because, again, their reading is very complex. It's not as simple as, okay, I can break down these letters. It's how, as I mentioned before, the segmentation, it's about the fluency, the comprehension, all of that.
Mm-hmm. Marianne says, my child has a dyslexia diagnosis and an ADHD diagnosis. For her IEP at school, which diagnosis should be the primary one?
So typically, in general, an ADHD diagnosis, generally speaking, would often be under a 504 plan, which means that your child is getting the same instruction that every other child is getting, but perhaps there are some things that they might need to be able to access that instruction better. So maybe they need a stand-up desk, maybe they need a fidget toy, maybe they need to chew gum because that helps them pay attention better, but they're getting the same instruction. Now, although there are some kids with ADHD where their learning is so impeded by their ADHD that they might go on an IEP, which is an individualized education plan, whereas dyslexia almost all the time would be or should be under an IEP, which is a legal document which a school is required to follow to the law, and these are very specific ways that a child is going to be instructed. And typically in an IEP, a child is not given the same instruction as a child without that diagnosis. So it might require a child being pulled out of the classroom, working with a one-on-one in the reading room or resource room. In my town that I live in the public school system, I'm very lucky that we have our public school system actually has a language-based learning disabilities classroom. So my son has been getting a one-on-one or small group instruction in Wilson with a certified, trained teacher, special education teacher. And that is under an IEP. So I would definitely stress of the two, the dyslexia and making sure that the dyslexia is really covered under the IEP and that they're following that to the law, that child is getting specific instruction by a certified teacher, not somebody who isn't trained in it, because it is a very methodical protocol and program, and that's really being taken care of. And then, of course, with the ADHD, making sure that within whatever instruction they're getting, that we want to make sure that they're able to attend and focus to it from the ADHD perspective. But I usually, in those cases, say, let's make sure that the dyslexia is being accommodated, and then we'll sort of, if a child still isn't focusing and paying attention, then we know that this part is the ADD speaking. But until you really have the dyslexia, how do we know that those inattentive issues are because the child is just completely lost and they're just not following the instruction, the curriculum? They can't access the curriculum, so of course they're going to be spacey and whatnot. So I would definitely really put the energy in the dyslexia and then kind of couch that and sort of cement that in with the ADHD accommodations.
Mm-hmm. Another parent asks, my daughter clearly demonstrates symptoms of dyslexia, but I've been told it is her ADHD, not dyslexia. Which healthcare professional is best to see for an evaluation of dyslexia?
And this is, I'm glad that this parent asked this question, and I empathize with this parent because this is a very, very common thing. And I find often that, a lot of times when I speak to parents who have kids with dyslexia and who I might see in therapy and who are not diagnosed with ADHD, but I see that there's ADHD, the initial reaction is this sort of almost this aversion to ADHD and this sense of like, oh, no, don't say it's ADHD. And it's not because there's a shame necessarily, although sometimes it could be that, but it's often because parents are told it's not the dyslexia, it's the ADHD. And so many parents have had to tirelessly advocate, no, yeah, perhaps my child has ADHD, perhaps they have issues with attention, but this is a reading problem. And what happens is that, and I, again, greatly empathize with parents because, they will listen to educators who say, okay, clearly they're educators, they know. And then what happens is that third grade, fourth grade, fifth grade, and then there's a wall. And what happens is that instruction in school goes from learning to read to reading to learn. And once you have to read to learn, you don't have a reading class anymore. You have science and social studies that rely on reading, and this child is way behind. And then we see the diagnosis of dyslexia come about. And meanwhile, parents often say, wait a minute, I was saying years ago that there was a problem, and I was told it was the ADHD. Please have that child tested for dyslexia. Go to a neuropsychologist who has experience with learning disabilities and dyslexia. The school can provide testing and screening. However, it's often not as specific as it is now. Having said that, I'm very well aware that different people have different financial resources. Neuropsychologists are not always covered by insurance. My insurance plan does not cover any neuropsych testing, so all of it was out of pocket. So one obviously has to take that into consideration. But if the school is doing testing, if you have to do the testing, ask very specifically, what measures are you testing for reading specifically? And I want to make sure that you're able to do an assessment that is not putting a lot of executive demands on attention, so that how can you properly screen out that this is in fact the ADHD and not the dyslexia? So have them prove it to you. Don't take it for face value. And I'm not saying that these teachers are lying. I don't want to sound cynical and negative, although I have heard horror stories, but oftentimes I really think that that's what they believe, that they honestly think, well, the kid is squirming and he's fidgeting or she's fidgeting and they're hyper. Clearly, they're not going to be able to attend to reading. And that could be true. I attributed a lot of my reading issues to ADD, and I would say that a large percentage of my reading issues as a child was related to ADD. However, having a child with dyslexia and becoming more and more educated about it, I'm looking back and realizing, I think that some of that was also some dyslexia that was happening that I think I just massively overcompensated for. But as I mentioned, I never read a book that was assigned to me in school until the 7th grade. And honestly, since then, in college, I read everything that was assigned to me. That was like my mission. And in grad school, I had 1,000 pages of reading a week, and I did it. High school, that was not the case. So don't take it for face value. In short, have it tested, have it screened, and a neuropsychologist can, in fact, answer that question.
You mentioned in your presentation that ADHD can exacerbate dyslexia. So I'm wondering, does ADHD medication help at all in terms of sharpening focus in a child who's been diagnosed with dyslexia? I mean, does medication play a role in this?
Yes, so medication, so we know that the stimulants and the non-stimulants can be very helpful for ADHD symptoms in terms of helping someone focus and be attentive. It helps with dyslexia only as far as it just makes someone better able to basically funnel their energy into doing what they need to do for the dyslexia. It does not, though, actually help the dyslexia per se. So it helps it indirectly in the sense that if it's hard enough to decode a word, to be unfocused and trying to do that energy to decode a word is going to be much harder. But it does not actually relate to being able to read better. It's not that a child with ADHD and dyslexia, if they truly have dyslexia, has a difficulty decoding words or phonemic awareness. They take a stimulant that they're now going to be able to decode. And what it can do, though, however, is it can help, and I've seen this before, it helps tease out the impact that the ADHD is really having on the learning and reading. And I've had many clients where this has happened, where the ADHD symptoms were managed with medication, and they were better able to take in the instruction for their dyslexia. And so their reading got better, but not because the stimulant directly was affecting parts of the brain that help you read. It's because it was enabling them to just focus better on just getting that instruction in that way.
Are there any apps or educational software, this is a parent asking, that can help my 10-year-old daughter prove her dyslexia? She's already using Orton Gillingham reading interventions to help her. I guess this woman is asking for something else in addition to an adjunct.
I don't know of any. I mean, I know that there, as I mentioned, like certain programs that people use, like Dragon Speak, like speech recognition software, audiobooks. In terms of apps, none that I'm aware of. I mean, it's actually something interesting that my son, he's almost 12, and he loves Shark Tank because he wants to be an entrepreneur. And he, since the age of 4, I believe, he started these notebooks of inventions, and he has these different inventions. But one of them actually recently we talked about was developing some sort of app that would be helpful to people with dyslexia, whether it's in promoting sort of self-advocacy or positive self-talk, or just reminding them of certain strategies that they might use. But I'm not aware of any app that helps with reading per se, as much as I am more about programs or organizations that give people sort of just better tools. I mean, I know that there are pens that if you run the pen over a word, it will speak the word. Again, there's a lot of these audio programs where you can, I think in Google, my son's teaching me a lot of these. You could put any document in Google and put it on audio, and not only will it read it to you, but it will highlight in yellow the words as it's reading to you, so you can follow along. And that's incredibly helpful for someone with dyslexia. It just makes it more multi-sensory, and it's very helpful for someone with ADD. So when someone has both ADHD and dyslexia, any multi-sensory approach, colors, gestures, all of that, acting out stories through the body kinesthetically, all of those things can be helpful. But it doesn't take away the fact that when there's true dyslexia there, that you need, again, those empirically derived interventions. Wilson, Orton Gillingham, Linda Mood Bell, nothing can substitute that.
A father asked, my son was just diagnosed with dyslexia in the 6th grade, and his self-esteem is so low because he has struggled for so long. that basically he wants to give up. Should I have him see a therapist to talk about his self-esteem issues while getting him the right interventions at school?
Absolutely, absolutely. Because what we need to understand about the experience of these children, and particularly if they were diagnosed, at a later time, is this is not a new thing. And I don't know this child, but I can safely guess that his self-esteem didn't just start yesterday. That, as I mentioned, this starts very young, where kids who are dyslexic have a very keen awareness, because interestingly, you'll often find, just like with ADHD, that dyslexic individuals can be quite intuitive, can be quite emotionally perceptive. There's a phenomenal book called The Dyslexic Advantage, which I would highly recommend people read or hear. I hear audiobooks. They develop a very keen awareness pretty quickly. Like, there is something different about me. I'm not reading the Harry Potter books like everybody else is, or I can't read. Maybe I'm reading the Harry Potter books, but it's taking me a year, where it's taking other people 2 months to do it. And then you start to shield, and you try to not have other people. It's like a secret. You don't want other people to see that maybe you're not as smart as it might seem you are. And then you can easily feel fraudulent, and you can feel like an imposter. And so by the time you get into 5th and 6th grade, where now it's evident, because again, you're reading to learn now, it becomes very evident. And that's why we see the largest amount of diagnoses around 4th, 5th, 6th grade, is his self-esteem has been slowly eroding for a long time. And so I absolutely would recommend him seeing a therapist and making it clear to him that nothing is wrong with him, that it's not that he is pathological or that he's ill, and that in fact it's more about saying, you know what, we want to basically teach you that this thing, dyslexia, is not something that is making you stupid. It's that you weren't getting the right interventions, and that's either because we didn't know, because a lot of times, it's hard to know, like when that's happening. The teachers might not have identified it. Maybe we thought it was the ADD. But once you get those interventions, you can succeed. But yes, I would empathize with the child and say, I would feel exactly the same way. If I went to work every day and I put in so much work in trying to help my patients, and I felt like nothing I said was sort of working. In fact, it felt like it was getting worse. And I felt maybe this information I have in my head is not the right information. And I came home defeated all the time. What's going to motivate me to even want to go to work? What's going to motivate me? And so school it just becomes this conditioned venue for defeat and helplessness and failure. And it's horrible. It's a really, really tough experience. And so, but the good news is, and I know I'm sounding very morbid, but the good news is that it has been identified now. He has this term, and now it's the work with a therapist, with the family, to really now say, wait a minute, I've learned now I can repackage this and understand what this really is, and I can thrive either despite this, or I can thrive because of this, and acquaint him with those models. If he is an athlete, let him know of these athletes out there that have learning disabilities. If he's an artist, there are many artists out there with dyslexia. If he's into business and someone who you think could be an entrepreneur, many of them. There's a study, the London in a School of Economics in London, that found that 40% of CEOs in Fortune 500 companies are either ADHD or dyslexic. And I don't think that's accidental. I think it makes a lot of sense, because I know, as someone who strongly has ADHD, that when you have a low tolerance for boredom, as I do, that you kind of exist outside the box in some ways. Like, it's not effortful for me to step outside the mainstream of how people think about things, because it's almost like that's sort of just how I've always thought. And dyslexics are the same way. They compensate in many ways and have these amazing connections that they could create between certain relationships that people who don't have dyslexia might have a harder time doing. So I would absolutely, have him see a therapist, but not have him feel like he's the ill one, that it's more about him redefining himself.
Well, I think we're out of time, Roberto. That was really terrific. I mean, it's helpful and inspiring, I think, to parents and professionals alike. So I can't thank you enough for doing this.
Thank you.
And I just want to repeat once again, the sponsor of this week's Attitude webinar is the Gauss School. The Gauss School is a college prep co-ed boarding and day school for students, grades 6 through 12, with dyslexia and similar language-based learning disabilities. Also offering a 5-week summer program for campers ages 8 through 16. Visit them at www.gow.org. So we're grateful for all of you for listening in, and have a good day, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.